How does echolalia affect speech in Parkinson's? To understand how echolalia affects speech in Parkinson's disease, we first need to clarify what echolalia is. Echolalia is the involuntary repetition of words or phrases spoken by others. It is often seen in various neurological and developmental disorders. However, in Parkinson's disease, echolalia is not a common symptom. Instead, individuals with Parkinson's typically experience other speech difficulties. In Parkinson's disease, speech issues often include reduced volume, monotone speech, slurred words, and a slowed speech rate. These challenges arise mainly from motor impairments that affect the muscles used for speaking. Cognitive changes may also contribute to these difficulties. While echolalia can be a symptom in some neurological disorders, it is not a hallmark of Parkinson's disease. Most research indicates that people with Parkinson's are more likely to face issues with speech production, known as dysarthria. This condition leads to slurred or slow speech rather than the repetition of others' words. However, some atypical Parkinsonian syndromes, like progressive supranuclear palsy, may show echolalia as part of a broader set of speech and language impairments. In these cases, echolalia may stem from disruptions in brain circuits that control language and behavior. In Parkinson's disease, the main speech impacts are related to motor symptoms, such as bradykinesia, which is the slowness of movement, and rigidity. These symptoms can make it hard to articulate words clearly. Non-motor symptoms, including cognitive changes, may also affect communication. However, these changes are more likely to manifest as difficulties with word finding or reduced fluency rather than echolalia. For individuals with Parkinson's disease and their caregivers, focusing on speech therapy can help improve articulation and clarity. Strategies to support communication when cognitive symptoms are present are also essential. While echolalia is not typical in Parkinson's disease, being aware of the full range of possible speech and language changes can aid in providing comprehensive care. In summary, echolalia is not a common feature of Parkinson's disease. The primary speech effects in this condition are linked to motor and cognitive changes. These can be managed with appropriate therapy and support. If there are concerns about unusual speech patterns, including echolalia, it is important to discuss these with a healthcare professional for accurate diagnosis and management.